Hi, I'm Dr. Heather Hirsch, and in this video, I want to talk to you about how to approach your doctor to have a conversation about menopause, particularly hormone replacement therapy. I know a lot of you watch my videos and you still struggle with getting a good conversation in with your doctor who may be unknowledgeable or biased. And I want to give you some tips and tricks on how to make sure you get the most out of that office visit. If this sounds like a great video for you, stick around. If you don't know me, I have a private telemedicine practice, and I really started my menopause career after I did a fellowship at Cleveland Clinic in 2014. And it was there that I learned that midlife and menopause was by far the biggest gap in women's health care. I then served as faculty at Ohio State and then at Harvard, and then launched my own private telemedicine practice. And we are growing into many, many more states with many, many providers who have all been trained under me, and I am so excited. I'd love to see you for an individual consult if you just need that second opinion, or you're not getting anywhere with your doctor, or you're just not getting the confidence that you feel that you deserve when starting on your HRT. How to have a good doctor's visit. Tip number one, I want you to schedule a separate problem-focused visit. Do not discuss this at your annual exam. Now, I have mentioned this before, and certainly I have heard the feedback that it's hard for some women to get to another appointment in a year. It's a barrier. Maybe your insurance doesn't cover it. But truth be told, at your annual exam is not a great time to discuss the complexities of menopause and hormone therapy. Now, medicine is definitely different than it used to be generations ago. It now really has become, for better or worse, a checklist process. And when you go to your annual exam, and I know because I'm also an internist, although I primarily practice menopausal medicine now, your internist has a list of things that they need to check off to stay up to date with whatever hospital system they're in. And that includes your height and your weight, medication refills, any social history updates, vaccines that you might need, screening tests that you might need, and then at the end you kind of mention your knee or your headaches, and they actually will charge you for a problem during your annual exam anyways. So it totally behooves you to schedule your own separate 20-minute visit just to discuss menopause, if that is at all possible. So just call up your doctor's office and say, I want to have a visit for menopausal symptoms or perimenopausal symptoms. Do not try to get this all done at your annual exam. If you must, you're gonna have about 2 to 3 minutes to do so. Number two, come insanely prepared. Come insanely prepared. And actually, what I mean by that is track and know your symptoms, your triggers, and what makes them better or worse, and if they're cyclic, i.e. do they happen before your periods? If you're postmenopausal, is it certain times of the week, certain times of the month? This is so crucial. You are going to use your time very wisely if you come in and say, hi, I've been having X, Y, and Z symptoms for this long. These are things that make it worse. These are things that maybe make it better or go away. And this is a cyclic pattern that I have noticed. If you can do that right up front, that's going to alleviate the stress or the wheels turning in their mind to try to figure out what this is. You're pointing them in the direction of the estrogen deprivation that comes from perimenopause and menopause. So know the last, I would say, 3 to 6 months of your symptoms. And if you're still getting periods, if you're in perimenopause, correlate those symptoms with your periods. Really spell it all out. Bring a handheld calendar if you have to, so that you don't have to waste any time thinking about it once you get there. Tip number 3, go through what you've already tried. Your doctor's gonna immediately ask you, what have you already tried? Or maybe recommend yoga or exercise, and you're just gonna start right off that list without even waiting for your doctor to ask you. So think about all the things that you have tried. This can fall under 3 big categories. Lifestyle, which is gonna include things like sleeping habits, sleep hygiene. I have a great video on sleep hygiene, my sleep hygiene tips. You can talk about exercise, you can talk about food choices, you can talk about if you stop, say, alcohol, since that tends to be a hot flash trigger. Go ahead and mention any of the lifestyle changes that you've already implemented, because I know that you already have. The second category is going to be herbals or supplements. Have you tried things like melatonin for sleep, or B12 for energy in the morning, or an over-the-counter menopausal supplement, something like estrogen or ashwagandha or black cohosh to help your hot flashes? Third is medications. And this may be from this doctor that you're talking to or a different doctor. And so mention any medications that you may have tried, because this could be a new doctor as well. This could even be a consult or a second opinion. So mention any medications that you've tried. Have you tried non-hormonal medications like venlafaxine, which is an SNRI that's often prescribed, shouldn't be first line, but often prescribed for hot flashes. Have you tried trazodone? Also should not be first line for menopausal symptoms, but have you tried any medications, and state those explicitly and state the outcomes. What you're doing in doing that is you're spending 3 minutes, leaving a good 17 minutes to discuss what you think you need. So step number 4 is then tell your doctor what you think you need. And particularly if you think you need hormone therapy, you can say something like, I have been doing a lot of reading about the safety and efficacy of FDA-approved hormone therapy for women who start within 10 years of menopause. If you want to go back, rewind that and memorize it, trust me, it may catch your physician off guard because it is going to sound so mature and so scientific and so evolved. And that's exactly what I want you to do. I want you to actually specifically say, I would like to be considered for hormone replacement therapy. I feel like I am a good candidate. You can clearly see that I've been having symptoms this long. You can see that these are the triggers. You can see that these are the things that I've already tried. And you can see that I've already formulated a thought about what I think would work best for me. Now, you might not be a hormone therapy expert. I do have a course for laywomen called the Reclaiming Menopause Masterclass. I will link that in the description below. It will walk you A to Z on everything you need to know about the safety of hormone therapy, and actually helps all my students know exactly what they should be on. Should it be the patch? Should it be the pill? Should it be Prometrium? Should it be norethindrone? Should it be the combined patch, a combined pill, a ring? There's so many different options. The class will teach you all of that. But if you've been watching enough social media and you've put something together, explicitly say what you think is going to be best for you. And your doctor really could say one of two things. Okay, that's great. I don't know a ton about this, or I know a little bit about this. Let's go for it. Or no, I don't believe in that. If you get a no, I don't believe in that, or if you get a that's going to cause breast cancer, or something that you know is absolutely false, I want you to do one simple thing before asking for another referral or a second opinion. I want you to take a couple of minutes, if you can find it in your heart, to educate that doctor. By you pushing back on that doctor, what is going to eventually happen is doctors are going to start to feel the pressure that many, many women are asking them about menopause and hormone therapy. And that is a good thing, because then they're going to go back to their administrators and say, I need more education on menopause. I actually also have a course for providers. I know I love courses, called How to Prescribe and Manage Hormone Replacement Therapy with Confidence and Ease. Is something that any clinician can take. But the more you try to push back and say, well, have you read about the safety of hormone therapy in the last 20 years? The Women's Health Study came out in 2002. There's so much updated information. Have you followed this doctor on social media? You really need to be re-educated about this, because hormone therapy is safe and effective. And if you don't prescribe it to me, I could do something worse, like go get unregulated compounded medications. Do you want me to do that? Now, I know this is a little bit of reverse psychology, but the truth is that you are probably more knowledgeable about your clinician on the safety of hormone therapy if you are at this point in the conversation with your doctor. And you can go get a second opinion. You can find another telemedicine practice. You can come see me and my providers. But if you can find it in your heart to also push back on that doctor as kindly as possible, that is going to help thousands of women after that doctor, if that doctor gets the education that he or she needs. This is totally a team effort, and I really hope that this was helpful in giving you some steps on how you can have the most productive visit with your doctor and how you can explicitly guide them towards the use of hormone replacement therapy. There's also tons and tons of publications and research on the safety of hormone therapy that you can point that doctor to. You can send that doctor to menopause.org, which is the home site for the Menopause Society's guidelines, or you can point that doctor to the National Menopause Foundation, or NMF, which is another great site. These doctors must be re-educated, and truthfully, I think they really would be happy to know that there is actual FDA-approved treatment that they can learn to prescribe. All right, I hope you guys loved this video. If it was really helpful, share it across your social medias, share it with your friends, consider subscribing to the channel. That tells the YouTube algorithm that this is such a great channel for all things evidence-based around midlife, perimenopause, menopause, and HRT. Thank you guys so much for watching my videos. I'll see you next week for a brand new one. Bye everyone.